I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome all of you to the 2023 Annual Public Health Address by the Jefferson County Health Officer, Dr. Mark Wilson. Thank you to everyone who is joining us here in person and those joining virtually via Zoom. The UAB School of Public Health co-hosts this event with the Jefferson County Department of Health each year as a part of National Public Health Week. This year's theme of National Public Health Week is centering and celebrating cultures in health. As we continue to adjust and adapt to new social norms, it is important that we focus not only on what we can do as individuals, but what we can do as communities to protect, prioritize, and influence the future of public health. We must look at how our cultural connections and intersections affect our health, well-being, and the public health system that cares for each of us. I'd like to encourage everyone in this room and online, public health professionals, students, faculty and staff, elected leaders, and the public, to step in and do what you can to make our county a more equitable, safe, healthy, and just place. Before I introduce Dr. Wilson, I want to be sure to recognize important groups of people in the audience. If you are an elected official or a local or state leader or dignitary, will you please stand and wave? If you are a Jefferson County Department of Health employee or a former employee, will you please stand and wave? Thank you for being here today and for all that you do and have done for Jefferson County and for the state of Alabama. And now I would like to introduce our speaker for today, Dr. Mark Wilson. Dr. Wilson became health officer of Jefferson County, Alabama in 2011, where he oversees the various programs of the Jefferson County Department of Health. Before taking this position, he served on the Jefferson County Board of Health for 3 years and worked for more than 20 years as a general internist in indigent care at the Cooper Green Mercy Hospital in Birmingham, including several years as outpatient medical director and then chief of staff. He earned a Bachelor of Civil Engineering degree from Georgia Tech and his medical degree from the University of North Carolina, Chapel Hill. Since coming to the Jefferson County Department of Health and prior to the COVID-19 pandemic, his priorities have included advancing health equity, improving birth outcomes, addressing the drug addiction crisis, advocating for tobacco-free policy, supporting the development of a trails and greenway system to facilitate outdoor activity, and more recently, establishing a strategy to address violence as a public health problem. He has also worked to expand partnerships between the health department and other community organizations to pursue common goals related to public health. During the COVID-19 pandemic, he co-led the Jefferson County Unified Command Pandemic Response, along with the County Emergency Management Agency Director. On several occasions, he issued countywide public orders and recommendations to help reduce community spread of the coronavirus. I'm very honored to introduce him today and welcome him to UAB's campus to deliver this important address and to announce him as the School of Public Health's newest public health affiliate appointment. Dr. Mark Wilson.
Thank you, Dr. Irwin and UAB once again for your generous hosting of this event, and to the UAB staff who helped put this together. Just want to mention a few other people. Thank you, Chris Osborne and Bryn Manzella, for your help in putting this together on the JCDH side. Thanks to all the JCDH employees who are here, those who are watching virtually. Thanks for all you do to help protect the health of people and our environment, and happy Public Health Week. I do want to welcome our health department retirees. I really appreciate your friendship and your support over these last several years. And welcome to our many partners, colleagues, and friends. I've often said that our success in public health has been because of our many relationships we have in the community. We appreciate you. And welcome to the students. I hope you find this time informative and that you'll take advantage of the opportunity to chat with some of our health department staff after this talk. I will say there are a lot of faculty people here, experts in public health. I've never claimed to be one, but I do want to say this talk is really geared towards the general public. I firmly believe that the more the public understands what we do in public health, the better. For those who are unfamiliar with our work, I want to define a couple of glossary terms for you that I'll mention throughout this talk. One is JCDH, that's the initials for the Jefferson County Department of Health. I want to point out that even though the name Jefferson County is in our name, we are not part of or a department of the county government. We are under the governance of the County Board of Health, Jefferson County Board of Health. And that's the other glossary term, is the Board of Health. The Board of Health is comprised of 5 positions elected by the Jefferson County Medical Society, plus the president of the county commission. The field of public health is very broad, as is the work of our local health department. So it's never possible to cover it all in one talk. I'll also add that I usually don't follow the rules for Public Health Week in terms of their themes. So my apologies to those who are sticklers for that. I decided this year to focus on environmental health. I want to preface my talk with a much bigger context than just the environmental health of Jefferson County. More and more, our Board of Health and our department leadership have been thinking about sustainability. It's becoming more and more critical that we focus on sustainability in order to fulfill our mission. From the World Commission on Environment and Development, a report called Our Common Future, 1987, commonly known as the Brundtland Report, sustainable development is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. In 2015, the United Nations developed 17 sustainable development goals, which were adopted by all member states. The goals were described as, quote, an urgent call for action by all countries, recognizing that ending poverty and other deprivations must go hand in hand with strategies to improve health and education, reduce inequality, and spur economic growth, while all the while tackling climate change and working to preserve our oceans and forests. You can see that several of these goals are focused on our environment. Today, I want to spend most of my time talking about 3 areas related to the environment where Jefferson County Department of Health is active: protecting our waterways, air pollution control, and climate change mitigation. Before I do that, though, I want to give you a breakdown of our Environmental Health Services Department at the Jefferson County Department of Health. Much of this work that they do is not related to the environment as most of us tend to think of it, the outdoor environment. A lot of it is traditional sanitation work that has been the underpinning of many of the gains in public health over the last 100+ years. Some of it is about the outdoor environment, but much of it is about the public's indoor environment. Most of you are familiar with our permitting and regulation of food establishments. Our food protection staff inspect approximately 4,000 places that serve food to the public in Jefferson County to assure food safety and sanitary condition in those establishments. They also provide training for workers who handle food in these establishments, and they conduct investigations of possible foodborne disease outbreak. Staff also conduct general health and sanitation inspection of hotels, camps, jails, and schools. Our Board of Health put forth minimum standards for communal living facilities in Jefferson County several years ago. This is actually unique for Alabama, but the board felt that it was important to protect individuals who live in these facilities and protect their health and safety. These are often people who are living off of a very limited disability check or social security check, and they can be susceptible to exploitation. Communal living facilities are certain publicly or privately operated homes or facilities that house 4 or more unrelated adult residents, commonly known as boarding homes or rooming homes. The Board of Health also in 2011 established regulations for our child care facilities throughout Jefferson County. This aim was to ensure that all daycares, regardless of their licensing status, regardless of whether they're religious affiliated or not, maintain standards that protect and promote children's health, safety, and well-being. Our department also inspects swimming pools and spas to make sure they're constructed properly and operated safely. We have a radiological health program that evaluates the equipment and operating procedures for X-ray and tanning facilities throughout the county to protect against harmful exposures. Our department licenses body art or tattoo facilities and permits their operators to make sure there's proper training, equipment, and procedures to prevent the spread of disease. We also have a rabies prevention program in environmental health, whereby animal bites are all investigated and steps are taken to make sure the animals do not have rabies. The Board of Health appoints a rabies officer every year, a community veterinarian who helps assure that all pets are vaccinated. And we occasionally put out bait in the environment containing oral rabies vaccine for wild raccoon population vaccination. During the first half of the 20th century, Birmingham for quite some time was known as the rabies capital of North America. There were hundreds of cases of rabies among our dogs and cats in the county for several years. The health department at that time, from the 1930s, 40s, and 50s, took very dramatic measures to get those numbers down. And by 1963, there were 0 cases among the animal population. The last known human case of rabies in Jefferson County was in 1959. Now, rabies is mostly found among our wild animals, such as bats, raccoons, skunks, and foxes, averaging less than 5 per year. Still, if you get bitten by one of these animals or a dog or cat that is not vaccinated, you don't want to take any chances. Rabies is 100% fatal if not treated early. Regarding general sanitations and concern about potential problems with disease vectors such as mosquitoes, flies, or rats, our staff will investigate complaints and work with property owners to help eliminate conditions that may lead to the breeding of these vectors. JCDH staff also investigates waste dump complaints and inspects municipal and county garbage trucks and collection areas. JCDH requires notification prior to any demolition of certain public buildings and residential structures to determine if asbestos is present, and if so, to make sure that asbestos removal is done properly by a certified contractor. As most of you know, asbestos fibers inhaled into the lung can cause cancer. Finally, JCDH provides sampling of public water supplies in coordination with other local agencies. So our environmental health staff has their offices on the 2nd floor of the Guyam Tate building shown here. But as you can imagine from what I've just described and what I'm going to be telling you about the rest of this talk, a lot of the staff are out in the community during much of the day. I also want to just make a note that our emergency planning and response team is currently housed within the organizational structure of environmental health. Of course, whenever we have a public health emergency or crisis that leads us to activate our incident command system, multiple divisions of the health department are typically mobilized. I do want to mention that our environmental health staff played a big part in the COVID-19 pandemic response, whether it was answering phone calls about emergency public health orders, assuring compliance with those orders, or helping with traffic control at vaccination sites. The environmental health team also played a major role in the World Games last summer, assuring food security and food safety for numerous events and venues throughout the county. Okay, we covered all of that. Let's move on to the areas that I said I would focus on. And first, the protection of our waterways. 30% of Jefferson County residences are not on the county sewer system. So they have to have their own on-site sewage disposal system. Most are comprised of a septic tank with underground field lines, but there are a variety of systems that are used. So the regulation and permitting of these systems is critical for preventing contamination of our groundwater, surface water, and nearby streams. Before a new dwelling can be built, there has to be a site evaluation by a qualified person. Plans have to be submitted to our health department for review to make sure it complies with the regulations. And then an environmental health specialist visits the site to determine its suitability for constructing the system, and later returns to the site to ensure proper installation. Department staff also investigate possible system failures and inspect system repairs. The department also certifies the competency of individuals who install, maintain, and repair on-site sewage systems. JCDH has a watershed protection program, or it's commonly known as the stormwater program. Stormwater is defined as water that goes directly from roads, buildings, and other infrastructure into our local streams, usually without treatment. Municipalities are responsible for controlling the runoff generated from local rain events. JCDH is a critical partner for our local municipalities to provide stormwater services and champion watershed protection. JCDH's program works with 22 member municipalities with 17 different stormwater permits. They provide industrial permitting and site inspections in cooperation with municipal partners, and they conduct water quality monitoring and bioassessment of our streams. Here's a list of the cities that are in the Stormwater Management Authority, otherwise known as SWMA. A little bit funny there, I guess. SWMA was formed several years ago as a cooperative entity to help several municipalities of Jefferson County comply with their stormwater permits as issued by the Alabama Department of Environmental Management in accordance with National Clean Water Act regulations. Note that there are some cities, including Birmingham, Hoover, and Bessemer, that have their own programs. These stormwater permits pertain to discharges from what are called municipal separate storm sewer systems, or MS4s. Just to be clear, the word separate means they are separate from the sanitary sewer system, so they don't go to a treatment facility before they drain into our streams. This means we have to be careful about what goes into these storm drains. Litter from near our streets gets into our streams. If someone pours paint or soapy water or other chemicals that enter the storm water drains, all of that ends up in our streams. JCDH monitors the quality of our streams, the water quality of our streams, using various techniques. One is through water sampling. You can see here that we have several monitoring sites covering 5 different watersheds in Jefferson County. We have 2 types of sampling. One is grab sampling, where water samples are hand collected and analyzed for pollutant concentrations. The other is continuous sampling, done in conjunction with the United States Geological Survey, or USGS. Data from these samplers can be found at the USGS's National Water Information System website under Current Conditions for Alabama Stream Flow. There you will find data such as pH, oxygen concentration, and turbidity, or how cloudy the water is. And here's what one of those continuous monitors looks like. JCDH also assesses the biology of streams in the watersheds of the SWIMA cities. Data on fish species in the streams have been gathered since 2010. Each major stream has two sampling sites, one located high in the watershed and one located lower in the watershed. Fish are captured, counted, and released alive back into the stream. The number of species is present is counted, and the percentage of each species are tracked over time. Although urban streams are not as healthy as streams in more pristine areas, the data at least show that stream health has been stable since the beginning of this study. Jefferson County Department of Health is also involved in several community-wide efforts directed at protecting our waterways. One is the Valley Creek Cleanup Event. The first Valley Creek Cleanup was held in the fall of 2011 and has been held every year since then. So far, this has resulted in 195 tons of trash collected from in and around the creek. The Jefferson County government, under the County Commission, has added an annual cleanup in the spring. So now we have 2 per year for Valley Creek. They started that in 2019. JCDH helps to promote that event. Another fairly recent initiative is Litter Getter, which collects floating trash in our streams. This is an initiative of our partner, the Freshwater Land Trust, with support from JCDH, the EPA, and several private funders. They have installed 12 litter getters so far in the greater Birmingham area. And as of the end of 2022, this has resulted in 10 tons of litter being removed from our waterways. Also, JCDH has been conducting household hazardous waste items to keep them out of the environment, including our streams. The Household Hazardous Waste Day has been held in conjunction with partners every April since 2019. Approximately 700 Jefferson County households have participated. Over 870,000 pounds or 435 tons of material have been collected through this event since its beginning. The next event is coming up on April 29th. There will be collection sites in Gardendale, Irondale, and Bessemer. And you can see there is a very wide variety of items that will be accepted. So start cleaning out your garage now. Now let's move to air pollution control. Let me start here with a little history. President Nixon proposed the establishment of the Environmental Protection Agency, or EPA, in July of 1970. It began operation on December 2nd, 1970, and later that month, Congress passed the Clean Air Act of 1970, and it was signed into law. There had been federal legislation regarding air pollution before this, but it had been mostly about studying and monitoring air pollution and issuing guidelines for states rather than federal enforcement. The Clean Air Act of 1970 and subsequent amendments gave the federal EPA authority to fight pollution. It established national regulatory programs with specific air quality requirements, federal enforcement, and federally issued permits, which required large industrial entities to address and control their contributions to air pollution. To its credit, the Alabama legislature followed up by passing Alabama's own Clean Air Act that complied with the federal requirements. That was in early 1971. It called for the formation of an Air Pollution Control Commission to establish enforceable state regulations in accordance with both state and federal Clean Air Acts. But Governor George Wallace delayed doing this for several months, leaving the state without any enforcement authority. Then, during the week of November 15th, 1971, there were warm temperatures and a high pressure dome that caused a thermal inversion here in Jones Valley. Air pollution from Birmingham's numerous steel plants was trapped in the valley, and the air was becoming increasingly toxic. The Jefferson County Department of Health at that time was led by a young health officer named George Hardy, who had taken office only 1 year earlier. Fortunately, he had the help of a very experienced public health administrator named Guy M. Tate, who had a good understanding of the local and state politics, and an environmental health director named Paul Pate, who had the technical expertise. The governor had finally appointed the Air Pollution Commission just that week, but they had not yet made their rules and regulations. So the health department was left without a set of enforceable regulations. So they decided to ask the 23 major emitters of air pollution to voluntarily decrease furnace output by 60%. A few of the smaller companies made some attempt to comply, but the really big companies mostly ignored the request. Particulate matter levels in the air had already passed the warning threshold of 625 micrograms per cubic meter. On Tuesday, November 16th, particulate matters hit 771 micrograms per cubic meter, with concerns that levels would soon exceed the highest emergency threshold of 875 unless immediate action was taken. JCDH then conferred with the Alabama Department of Public Health and the state attorney general, and together they decided to ask the EPA and the federal Justice Department for assistance. The result was that for the first time in the EPA's early history, it had made a decision to force industry to reduce harmful air pollution. Once the documents were prepared, federal judge Sam Pointer was awakened at 1:45 a.m. on Thursday, November 18th, and he signed a 10-day temporary restraining order compelling compliance by the local industries. Today, JCDH administers the air pollution control program for the Jefferson County under the Board of Health rules and regulations. This includes regulations of major sources of air pollution for which Title V major source operating permits are issued. These Title V operating permits are based on the potential numbers of tons of pollutants the source might emit, depending on the types of pollutants emitted. One type of these regulated air pollutants, is the regulated air pollutants, as they're called, which are the familiar ones: particulate matter, nitrogen oxides, sulfur dioxide, carbon monoxide, volatile organic compounds, and lead. Any source that may emit over 100 tons per year of these must have a Title V permit. It's like a lot, doesn't it? The other type is designated as hazardous air pollutants, or HAPs. The EPA currently has a list of 188 of these. Any source that may emit over 10 tons of any one of these or 25 tons of any combination of these also has to have a Title V permit. In Jefferson County, there are currently 24 entities that have Title V permits issued by JCDH. Quiz time. Can anybody guess what the Title V entity is that's closest to where we are right here on the UAB campus? Any guesses? Just shout it out. UAB. Oh, very good. Did you hear that? It's UAB. UAB has a Title V permit. Here's a copy of it. It really is interesting to look at it. I spent a little time reading through it at bedtime, and it's very instructive in that it shows you how detailed these permits are and how much monitoring and regulation there is. UAB's permit has 50 pages attached to this. UAB has boilers for the steam plant, multiple other buildings, backup generators for its buildings, a couple of incinerators for medical waste, and a gas dispensing tanks and station. So it's a big operation. Of course, everybody knew that, right? Still, while we still need the air to be cleaner, we have made tremendous progress since the passage of the Clean Air Act. And the air in Jefferson County now is cleaner than it has been in many decades. This table, looking at the 5 main regulated pollutants emitted by local industry, shows how dramatic the progress has been. From 1997 to 2021, the total tonnage per year of these pollutants emitted by industry in Jefferson County has decreased from over 234,000 tons per year to about 28,000 tons per year, an 88% reduction. Additionally, Jefferson County has been in attainment with all national ambient air quality standards since 2015. I do want to mention that there are minor sources of air pollution that our health department also regulates. A couple of examples are dry cleaning facilities and gas stations. In fact, dry cleaning chemicals and gasoline vapors can cause cancer, and they also contribute to production of our ground level ozone. Here's the ozone trend line over the last 25 years. The red dashed line on this graph is the EPA standard, the National Air Quality Standard. You can see how it's been tightened over time. And currently we're just a little bit below the current 0.07 parts per million threshold. Here's the trend line for particulate or fine particulate matter, or PM 2.5. You can see where we are below the 12 micrograms per cubic meter threshold currently. However, the EPA is currently considering a tightening of PM 2.5 to between 9 and 10. So it's possible that could become a challenge for us here. We've reached the point in Jefferson County where mobile sources of pollution, as opposed to stationary sources that I've been talking about, represent more than half of the emissions. By mobile sources, I mean cars, trucks, trains, airplanes. These are now the majority of pollution, causing the majority of pollution in our county. Another non-industrial source, is fires. Not just intended fires, but what we refer to as open burning, such as burning of trees and brush cleared from a new construction site, or people burning trash or leaves in their backyard. You may not know this, but except for cooking, open burning is prohibited in Jefferson County from May through October. And open burning is also prohibited on all the other months unless you get permission from the Jefferson County Department of Health. And this is something we actually take quite seriously, and we sometimes issue pretty hefty fines for violation of this, because this is one of the things that we can really improve. Anybody know what this is? This is one of our air monitoring stations. JCDH has a robust air monitoring system, which we periodically upgrade or adjust as needed. We currently have 9 monitors, which is a lot for the areas of Jefferson County. Real-time data are available to the public through an arrangement we have with the University of Alabama at Huntsville. These data are used to determine compliance with the National Ambient Air Standards. As I mentioned, we're wanting to better understand the relative contribution of those mobile sources. So we've recently added a new site at the Arkadelphia Road near the interstate to look at that. And this is a county map that shows you the location of our monitors currently. So this number of monitors is almost the number that ADEM has for the rest of the state. We plan to put air monitors at schools throughout Jefferson County that provide real-time measurements of particulate matter. We'll be using the brand called Purple Air. We'll start with urban schools and then expand to other schools in Jefferson County. This will be at no cost to the schools. The monitoring data will be accessible to the public real time. Our goal is to place the first monitors by the end of 2023. We had placed a few of these monitors at schools in Trussville and Liberty Park to monitor the air during the recent St. Clair County landfill fire, because there were a lot of concerns about this among the public. Idea of placing these at more schools going forward is to use these as a teaching tool for students to help inform parents and the general public and us about the impacts of fires and other sources of particulate matter at the hyperlocal area. I want to say a few words about environmental justice. According to the US EPA, environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. This goal will be achieved when everyone enjoys the same degree of protection from environmental and health hazards and equal access to the decision-making process to have a healthy environment in which to live, learn, and work. In keeping with this, JCDH provides an enhanced notification process for actions related to our major air pollution sources for areas where environmental justice could be an issue, using the EPA's EJ Screen tool. Enhanced notification includes communication with elected officials and other important officials regarding permit applications, renewals, and related timelines. General public notifications are available online, and then mailed and emailed notifications to individual members of the public who wish to be on a distribution list. JCDH has created an online database that allows the public to view files and documents for all of our permitted facilities. So that UAB permit was an example. That's on our website, and you can see all of those details. On 2 occasions recently where civil penalties have been awarded to JCDH by industries for alleged violations of the regulations, JCDH has chosen to set aside penalty funds to reinvest in the nearby communities. In 2021, 100% of a $387,500 penalty for alleged violations at ABC, Coke, and Tarrant was granted to 11 community organizations to address healthcare needs and social determinants of health in the city of Tarrant, the North Birmingham community, and the neighborhood of Inglenook in Birmingham. Representatives from those communities were included on the committee that decided the grant awards. Just this past December, we reached a settlement with Blue Stone Coke in North Birmingham for multiple alleged violations, resulting in a civil penalty of $925,000. Half of that will go towards creation of buffer zones, green space, or some other environmental improvement project in the North Birmingham area, again, with community input. I also just want to add that because JCDH is a regulatory agency, we cannot advocate for or against industry. Our job is to issue permits and enforce compliance. Some people in the community have been led to think that when it comes time to renew a permit, they can influence our decisions to deny a permit if enough people sign a petition or show up at a meeting simply saying, deny the permit. It doesn't work like that. If the facility has been cooperating with our regulations and our program personnel, and the permit includes all the proper air pollution controls, we have no grounds for denying it. Unfortunately, though, we have inherited city zoning for many years that allowed heavy industry to be located immediately adjacent to residential areas. In order to help address that, the Board of Health in late 2019 passed a resolution to establish the Sustainable Industrial Residential Buffer Zones Fund at JCDH and placed $2 million of the department's unassigned fund balance into that fund. The idea is to create green buffer zones between industrial sites and places where people live, hopefully with partners that can provide additional resources and assistance or to leverage other funds. The pandemic hit soon after that, so we didn't do a lot with it for a while, but we are nearing the completion of a final agreement to invest the first $200,000 of that fund to create a buffer between the old Pullman train car site in Bessemer, now occupied by the Blocks manufacturing plant, and the neighborhood across the street. In this picture, you can see the barren area at the top that currently exists along the fence line with an unsightly rail yard on the other side. And then on the bottom, the plans for a buffer of trees and other plantings. That neighborhood, by the way, is going to be redeveloped for some low income or affordable housing. Like many of you, I have been growing increasingly concerned that we are not doing enough fast enough to address the threat of climate change. According to the Intergovernmental Panel on Climate Change at the United Nations, the CDC, and others, climate change is expected to lead to increases in heat-related illness, lung and heart disease, food and waterborne illnesses, vector-borne diseases, food insecurity, injuries, mental health and stress-related disorders, and disruptions adversely affecting social determinants of health and health inequities. Local health departments have a role to play in informing their communities about these threats and working with partners to encourage mitigation. After discussion with our Board of Health last year, they decided to pass this resolution affirming that climate change poses a serious threat to public health. Some of you may think, well, that's obvious, but that had not been done here, and we felt that it was important to make steps. That resolution also directed our health department to develop a sustainability plan, which includes reducing its use of fossil fuels and increasing its use of renewable energy for its operations. We still have more work to do towards a comprehensive sustainability plan, but we have decided that as we decommission our vehicles in our fleet, and we have about 100 of them, we are replacing them with electric or plug-in hybrid vehicles as much as feasible. So I was looking at other ways to address climate change locally. I became increasingly interested in the benefits of trees. Trees provide shade, lower urban temperatures, filter out particulate air pollution, help people tolerate outdoor exercise when it's hot outside, help prevent flooding by slowing down water runoff during storms, while tree roots pull water up out of the soil. Trees make neighborhoods more livable. And there are other benefits. While you can find lots of trees in the greater Birmingham area, we have some urban areas with a lot of pavement and concrete and a relative scarcity of trees and shade. Then I came across this cool green story map, which is on the UAB Lister Hill for Health Policy website. I encourage you to take a look at it. It mapped the following variables in Jefferson County: percent green space, percent impervious surfaces, degree of summer night cooling reduction, annual water runoff, acute respiratory symptoms from in emergency departments, and the amount of tree canopy. Putting these data together, it identified what they called cool green opportunity areas. Some examples were parts of Bessemer, Inslee, North Birmingham, of course, downtown and areas just west of downtown. These are areas that would benefit from having more trees and other green infrastructure projects. So I spent quite a bit of time going around meeting with different organizations to see who might be willing to start a new tree planting initiative for Jefferson County, which I initially thought would be called Trees Birmingham. Then I came across a willing partner in a nonprofit organization called Coaco Resource Conservation and Development Council, whose self-described mission is to connect central Alabama communities to the resources and partnerships needed to drive economic development in an environmentally sustainable way. For Francesca Gross, who is here, she's an environmental specialist for Coaco. She said this was something she had been dreaming about for years. I asked for a budget proposal, to get an initiative started and staffed, and JCDH provided a grant to cover the cost. A community advisory board was formed, and the initiative was named Cool Green Trees. The mission and vision of Cool Green Trees is to improve the environment and community through planting trees and to mitigate the negative effects of urban heat islands, stormwater runoff, and air pollution to uplift the community economy and health of Jefferson County, Alabama. This slide is just a schematic to illustrate the amount of temperature difference that you can have in different parts of a county like ours based on the amount of tree canopy. And that's about realistic, a range of up to 5 or 6 degrees. So Cool Green Trees now has a website. I encourage you to check it out, including hitting that donate button, because we need more money to actually pay for trees and help get them planted. One hot day when I was walking outside of the health department, I looked around and noticed that there weren't enough trees around our own building. It's pretty hot out there in the summer. And I realized that we had better practice what we preach. So we put tree planting into our budget for this year, and we have plans and a contractor lined up. You can't really see this slide, but this is the plan. So that includes my main remarks. I do want to move on to our Public Health Champion Award. It's been our tradition over the last few years to give a Public Health Champion Award to an individual and/or organization within our community public health system that's made a significant contribution towards making Jefferson County healthier for all. This year's Public Health Champion is Jane Reed Ross and the landscape architecture team at Goodwin Mills Haywood. Jane, you all want to come on down here and line up your team? I'll make a few more comments while you do that. This year's, I guess I've got the, yeah, here it is. This year's, the decision to give this award to Jane and Goodwin Mills Haywood is a little different than previous ones, which have mostly been in the nonprofit world. However, their work cannot be ignored. In fact, you can't walk outside from here and go very far at all without encountering their work and benefiting from it. One of the parts of their environment that I didn't talk about that's very important to our health is the built environment. And Jane and her team's contribution to the design of the built environment in Jefferson County has made a huge impact. Jane was part of a team that designed Railroad Park. She and her team did the original Red Rock Trail System design that was funded through the Centers for Disease Control in order to combat obesity and awarded to JCDH and its partners at that time. And she oversaw implementation of 5 of the Red Rock Trail System projects funded soon thereafter in 2012 with Federal Department of Transportation grant money along with local matching funds that included funds from JCDH. She and her team designed the Rotary Trail, Homewood's Central Park, the Birmingham Zoo Gateway, and some of the landscape work, beautiful landscape work that you see right here on the UAB campus. Jane, thank you for your amazing contribution to our community. It's obvious that it's more than just a job for you. You may. I want to show everybody the award. Forgot to get it out earlier. But this is the Public Health Champion. I can't see it very well. Public Health Champion for encouraging outdoor physical activity and protecting the environment. April 4th, 2023, presented to Jane Reed Ross and the GMC Landscape Architecture. I'll also mention, we've talked about stormwater control. A lot of those features I mentioned, including Rotary Trail and Railroad Park, are designed to help handle stormwater runoff and filter it to protect our streams. So, Jane, congratulations.
Thank you so much.
Maybe some pictures.
May I say a few words?
Yes, please say a few words.
Okay, all right. Thank you, Dr. Wilson. That's so incredible. And it's such an honor to work with you and the health department and all the partners that you bring together. It's just pretty amazing. I'd like to recognize some of my GMC team that's here today that's helped on these projects. Gary Owen, would you like to stand up? And Reed Fincher, landscape architect, stand up. Brian King, landscape planner. And is there anybody else from GMC that's here? Please stand up. I'm going to recognize Francesca Groves because we've worked with her a lot on many projects. So you can stand up too. And I'd like to recognize my husband here, Neil Ross, who is a great partner in all these projects. And he promotes this work that we've had the great pleasure of working with everybody on. So thank you so much. Since I'm up here, I'll just continue. I'd like to do, on the behalf of the GMC family and our partners, a shout out to Dr. Wilson and his innovative leadership in our community in protecting our environment and giving us opportunities to improve the quality of life of people with quality green spaces and parks and trails. And so I would like to present to you a number watercolor print of pink muley grass in Railroad Park.
Oh, wow.
So thank you so much.
Thank you.
You're most welcome. Thank you for everything you do.
Thank you, Dr. Wilson. And congratulations again to you, Jane Reed Ross, for your work and to your group as well. Dr. Wilson, we will continue to thrive. We will continue to benefit from your forward-thinking initiatives such as the Cool Green Trees for many, many years to come. Your legacy will continue. Thank you. I would like to thank each of you for attending the 2023 Annual Public Health Address. Thank you, Dr. Wilson.